how to manage the digital transformation. We're lacking behind. We're not good at that. Doctor can be a doctor and not a secretary. We have a very healthy startup scene here. Well, everything is expensive in Switzerland. You're drowning in the sea of work, but you don't have time to learn how to swim. Bingo, let's go for healthcare.
Hello everyone, we're in Switzerland and I'd love to introduce our today's guest. His name is Alfred. Hi Alfred.
Thanks for having me, Alex.
Let's start with a short intro. Please tell us a bit about your background.
Yes, well, basically I'm here in Switzerland, professor for healthcare management, but it's a long story. And if I start from the beginning, I was born in Mexico, lived there my first 10 years, and we moved with my family to Germany. I have been living in Switzerland, in Austria, in Scotland, but now the last 15 years I've been here in Switzerland. My background is industrial engineering, so I'm business science, so I'm kind of mixture between everything regarded to business, and the other half is loving for everything with technology, IT, and so forth and so on.
But at what point did you actually get involved in healthcare specifically?
Yeah, that's another story. Because I started my career in the industry. I was working for the food company Nestlé. Then I spent some couple of years with McKinsey, the consultancy company. And so nothing related to healthcare, but always about process and process optimization. So how can I ensure a better quality, a higher quality with less money, with higher efficiency? And I've been here at the university for the last 15 years. And around like 13 years ago, my boss came to my room and said, I'm teaching operations management processes to a couple of doctors, nurses, and just took my slides from the industry, and they hated it. So I need to develop a new course, but to be very honest, I don't want to do it. So Alfred, why don't you take over this course? And so I started thinking about, well, why not healthcare? What kind of problems do they have in their sense of process optimization, digital world? And I noticed, they're lagging behind like 10, 20 years. This is perfect. It has a purpose. They're lagging behind. There's a lot of money in it. Bingo. Let's go for healthcare.
Interesting. Let's immerse our viewers so that in the atmosphere of healthcare system in Switzerland. Can you tell us some pros and cons, what you see from your point of view?
So to understand the Swiss healthcare system, you need to know it's a mixture between centralized, obligatory to have, for example, insurance from an insurance company. On the other hand, there's competition. So you can choose which kind of insurance you want to have. So it's always a mixture between they force you to have a health insurance, but you can choose from which side.
Is it expensive?
Well, everything is expensive in Switzerland, but you can say it, yes, it's expensive. The Swiss healthcare system overall is expensive because we are the third most expensive country in the world. Obviously, USA is always the most expensive one, but we have been overtaken by Germany. Now we're placed third place. With about 11-12% of our GDP we give for healthcare. But no, the thing is everyone can afford it. If you are too poor to have insurance, then the state will come in and help you. So no one is living on the street and without insurance. That's not the case here.
That's good. Are the hospitals both public and private?
You have both. You have private institutions, you have public institutions. You can choose which one you prefer. And it's not like in other countries, for example, Mexico, where you say there are the private ones and they're the excellent ones. And then if you cannot have enough money, you go to a public one and you are screwed. No, they're around the same quality here. And so I think everyone gets a really high quality of service here in Switzerland. We still have a lot of money that we put in our system. So the waiting times are, for example, much shorter than in other countries. Most people would say we have also excellent quality in our healthcare services. The funny thing is, if you ask my colleagues here and the other professors doing health economics, to be very honest, we have not that much data on the real quality. So that would be an issue that we don't really know, especially in continuous of care. So we know one hospital is excellent, but you leave the hospital 1 year later, you have any problems after that, and we cannot connect both issues with each other. So we don't really know if the continuum of care really works that well as we perceive. But perception is reality.
What else do you think should be improved in terms of the system?
Oh, there are many things that can be improved in our system. I think we have become a little bit slow because of the money. We have not had enough pressure lately. It's, for example, workforce scarcity. Every country is complaining about that. We had the luxury in the last years that we were attracting people from all different countries. So if you go to a hospital here in Switzerland, here in Zurich, for example, 30% of the people will be from abroad. Many German doctors and nurses, for example. Yeah. So we were very good at attracting people, not so good in developing our own people, training our own people. But the worst problem we have at the moment is indeed how to manage the digital transformation. We're lacking behind. We're not good at that. Usually, if you look at the country rankings, Switzerland, for example, UN ranking about who is the most innovative country in the planet, we are place number 1 according to UN for the 12th time, I think. Regarding digital health, we're in the last third or so of Western countries. So if you want to learn about digital health, maybe you should look somewhere else, but not here. Interesting.
You mentioned that you've attracted lots of doctors from abroad. The obvious reason, probably higher salary?
Yes. Well, it's a combination of higher salaries that always help, but also the conditions were quite good. So if you look, for example, how many in a hospital, how many nurses you have per bed, how many doctors you have per patient, they're pretty good ratios. So these horror stories that I hear from many neighbors from France, Germany, Italy, that during the night shift, one person being responsible for the whole ward. That's not yet the case here, but we are in a shortage as well after COVID, so we have to look at this for sure.
All right. Since we started talking more about hospitals, smart hospital. How do you envision a smart hospital? How it should look like? Mm-hmm.
Well, when we have such questions here as a university, what we do is we go to our government and ask for money to do some research, right? And so what we did 1.5 years ago, we started a big research project called Shift. So if you go there to our website, future.hospital, you will see we have like a consortium of 20 hospitals. We have 24 industrial partners, and we have 5 different universities. And we are trying to find the answer to your question, what is a smart hospital? So what I can tell you already now, what we envision is a combination between, let's say, the right technology, the right organization, and the right focus on people. Obviously, if you think about smart hospital, you would start with the technology. And we're doing that as well. So, for example, one of the sub-research projects is about what kind of sensors should you have on your patients to monitor them all the time? What are all the data that you want to collect? And especially what you do with that data. What is really relevant? What can you do with that data? So that's one part of the smart hospital. It gathers data from everywhere. But another important part that makes the hospital not only smart but also liquid means, well, but my hospital, I'm there for 10 days. If I'm a chronic patient, I will suffer from that for the next 20 years. So most of the time I'm at home. So how can we take this technology and break the walls of the hospital? And it doesn't matter if you're at home, at your appointment with the doctor or in the hospital, we have like a continuous collecting of all this data. So this will make the frontier between this is happening in the hospital, this is happening in home, irrelevant. That's not really important how to treat you the best way. So that's one part about the technology to do this. Organizational stuff, it's always important. How do I manage the people? What kind of competences do we need them to have? And for example, there many hospitals that are not that smart at the moment have a lot of issues with resource assignments. So which person should attend to which patient and which bed and which location. So this is a very complex problem that is wasting a lot of time of people and a lot of resources. What we try there is with artificial intelligence to make this problem, to solve this problem. So how can we really have some smart algorithms that can decide this patient should be on this appointment for this duration? A lot of things to do there. And the last thing was about persons and people. And the best hospital with the best technology, with the best medicine will fail if you have not the right attitude, the right cultural attitude of your staff members. For example, in our hospitals in Switzerland, we think a lot in silos, so little compartments. So I care about my unit. I don't care at all if other units are doing well or not, because it's not my budget. So why should I care? And for example, we are trying to break this mental barrier of the thinking system. You have to think not only about you and your little team, about the whole hospital, about the whole system, by developing a serious game, a simulation where we teach people the value of collaboration and thinking bigger, not in your next budget and your little team. So that's what we do, and all these things together will make a smart hospital.
That's really interesting. So before you mentioned that Switzerland is a bit slow in adopting new technologies. So we have hospitals and management of hospitals, we have government, we have great researchers like you are who come up with all the data that needed to change that situation in the hospital. And then we have digital innovators who actually come up with those technologies. Who among these all components should be the driver of innovation and adoption of innovation? Yeah,
that's a good question. Who should be and who is it? At least in Switzerland, we have a strong aversion against centralizing things. So in other countries like in Denmark, where they're defined from top down, these are the 4 hospitals that we need and these are the organizations that are going to improve them. We don't like this here in Switzerland. So therefore, we try to make the central government, their role as small as possible. For example, we have been talking the last 14 years about introducing electronic health records, that you have your data and you can take it everywhere. Doesn't matter with which doctor you are talking to. We have been talking about this for 14 years. We have now a rate of 0.1% of Swiss persons have an electronic health record. So 99.9% does not have one. And one of the reasons was, well, we don't have one system with one standard, but the Swiss government decided, well, every canton, every region can have their own. So we have 20, 30 different systems competing against each other. So to try to make the government or the driving seat is not working here. So I would say it's indeed the place for individual organizations. What we have here is either startups or healthcare providers who are really trying new things out. This is like the source of innovation. And astonishing as well, also many insurance companies. This sounds for people coming abroad, sometimes a little strange. Our insurance companies are not all the time focusing just cost. They're basically forced to be non-profit. So they are just there to provide or to make the link between there's a service provider, here's insurance, patient, and they manage the money. But they want to be more than just the money managers. So they are really also very open to innovation, how to improve processes and how to help patients better. So a long story short, I think individual persons and companies, those are the drivers in Switzerland.
How do you perceive the regional startup scene? Do you think there is a lot of digital health startups in Switzerland right now?
I would say we have a very healthy startup scene here. I don't know if it's a lot. I don't have numbers compared per capita, so to say, but I know of many, especially young persons, who are really driving forward the whole thing. I see like two different groups. When you think about startups in the medtech sector, it sounds that's not the two persons doing something crazy. That's more like the multi-million startup getting a lot of money and thinking globally. That's the one group of startups I observe. I don't have that much contact with them. I have more contact like with a single doctor together with a nurse. They decided, hey, we are really tired of, for example, documentation. And we did a study about how much time do I spend as a doctor documenting? How much time do I spend with the patients? I became doctor because I want to treat patients. In the hospital, we went there and observed nurses and doctors for 1 week, and it came out while the typical doctor is 20% of their time is on the bedside talking with patients, 80% doing other stuff, like walking around, doing a lot of documentation, something of that sensible, something not that sensible. Nurses, 30% they spend with patients, 30% of their time. And so, for example, one startup I just talked to Adam Cares. They told me, can we make this more efficiently, especially this documenting part? Why do I have to spend 30-40% of my day writing down what I have done? Why cannot technology help me? And this is just one little example, but it really shows how we have really strong drivers here from individuals that go out and try to improve their processes, improve their life. Those are the startups I observe the most here in Switzerland.
I'll tell you my personal view, since I done my research and talked already to lots of startup founders. I think there's a lot, actually, comparing to lots of European countries. I think there are really a lot of startups in Switzerland. Do you think that the number of large pharma is one of the reasons why there are lots of startups? Do you think pharma is trying to collaborate with startups?
Yeah, well, they are trying, obviously. The pharma companies I've been talking to, they're more like not on the driver's seat, maybe laid down in the back of their cars, observing the scene. And if they see a good opportunity, they will take it. So I think pharmaceutical companies have been a little bit slow with adaptation to all this digital health stuff. So I don't think they're the main drivers. There will be obviously a big facilitator. Once you really want to conquer the worldwide market, you need to start thinking big, you need a lot of capital. There they come in. But I think the most innovative things come from the bottom, from individuals. So no, I wouldn't say that the big pharmaceutical companies in Switzerland is one driver. I never thought about what is really the driver, but maybe, you need to take a risk to become independent, to start your startup. And we have to say most of our people in this country are not fearing of being unemployed or don't having enough money to pay their rent. So maybe this also facilitates things that, what?
I'll try it.
I'll try it. What can happen? I would make this 2-4 years. And if I fail, I'm a nurse. There are 20 companies who will take me back. So let's go for it.
That's a really interesting point. All right, let's talk about some of your work and your books, and let's start with lean healthcare. Could you please explain the term? Try to be short.
Oh, sorry, I thought I could speak here for 2 hours. No. Yes, okay. So it's a management philosophy. It comes from the industry, from the car industry, basically from Toyota, and so it's already old, 50, 60 years. And the most important thing is to explain it with a why. Why should I adopt this philosophy? And I already gave you one of the explanations, like if you are really passionate about your job in healthcare, you want to focus on helping people. And our organizations are not really good supporting those individuals to do what they really are looking forward. So lean comes here has a philosophy, has some principles, has a lot of tools, and helps you to focus on whatever you think is the core of your work. If I'm a nurse, I want to attend to patients. And so this philosophy helps me to do exactly that. Less time spending with administration, make it lean, so make it only help me to focus on what is important for me. And this is a triple win. It's a win for, already started with the staff because they can do what they think is most important. It's also a win for the organization. If I have doctors, I don't want them to spend 40% of the time writing things down. They're much too expensive. They should treat patients. That's how I earn money. And the third win is about patients. If I'm there in a hospital and I notice the doctor, she has exactly 2 minutes for me, then she's running to the next patient, I won't be happy. So lean helps mitigating all this.
Really interesting. In your new healthcare management approach, you propose 7 management concepts to make a major contribution to the further development of healthcare system. They are positive leadership, value-based care, design thinking, lean and Kaizen, self-organization, agility, and digital health. So the question is, do you think, are they equal value or there's like some kind of priority?
Well, it's like asking you, which of your children you like most. Yeah. Okay. The first message is, what we did is we tried to think about what does it mean to have the new way of working, new work as a key word here. What are the management systems of the future? And I think we all agree that the traditional hospital, like how it was structured and used for the last 100, 150 years, is not the right place and not the right organization form to go forward. So we started thinking about collecting all these different approaches on how to solve that. There are 1,000 people, they have one purpose. How do we work together? And we came up with this list, and we had to get rid of 1 or 2 systems, and we had to decide finally on those 7. Yeah? And I think all of them make sense. And the interesting thing is, after a while, we notice there are connections between them. It's not like you do either A or B, but they really rely heavily on each other. For example, if you think about positive leadership or value-based healthcare, they are very important because they answer the question, why? Why should I work in this hospital? By the way, it's not only focused on hospital, you can also think about insurance, pharmaceutical companies, and so forth and so on. So those management concepts help you to find the true purpose and to have an organization that supports you in finding those. Okay, so maybe that's the first step. The second step is, okay, at the end of the day, if we want to survive in a market, we need high quality, we need high efficiency. So the other tools help to achieve that. If technology is changing all the time, maybe you should start thinking about being agile. If you have problems with how much it costs, well, you have to look at your process. You have to design it with design thinking and come up with creative ways. With lean, you get rid of the waste. With lean also, you help to engage your community, to engage your staff, to come up with new ways of working. That's also part of the Kaizen way of thinking. And yes, and once you have all this beautiful established organization, digital health helps you, obviously, to automate things. And so there's a natural order and link between all these different concepts. And I think you cannot do all 7 at the same time. You have to prioritize. But I think sooner or later, every company in healthcare will have to start thinking when and how fast should I implement those management concepts.
How do we help them implement them faster?
Yeah, okay. The funny thing is, well, we are working very closely with many hospitals and healthcare professionals. Their main problem at the moment is time. Yeah. So whenever I suggest, hey, we could do a design thinking session, we could start looking at your processes or think about how do we implement a patient portal, this is our digital health solution. The first answer is when should I do that? I have so much to do. So this is a problem. I always say it's a problem like you're drowning in the sea of work, but you don't have time to learn how to swim. And so the main problem is you need to, if you are here in a management role, you need to give your staff members certain time where they can really start about innovating the processes, innovating the technologies, innovating how the way they work with each other. So the sad news, and I'm a businessman myself, so I know that you don't like to hear this, but you need to invest money. And you need that money mainly in the form of you have to pay for your staff for not doing how they earn money, treating patients, but being in a workshop, developing new technologies, experimenting around. So the biggest help would be to give some space to my workers so they can start thinking about what would be a smarter way of organizing ourselves.
I hope some of the managers that are going to watch our interview are going to listen to your words and do that, invest more time and probably money in educating and helping people find that time to do that. Okay, I think the next question would be logical to ask. What could the future of healthcare look like, according to you?
I'm very positive about the future. So if I start thinking how will be the healthcare system in 2050, I'm very positive. Yeah, I think we have been making a lot of progress. You know, they say that like in the 1950s, that our knowledge about healthcare and medicine doubled every 50 years. And these days, the number, well, you can argue about if it's the right number or not. It's about 75 days that we double our knowledge. So if this continues like that, it's really a bright future in front of us. Yeah? With all the dangers with digital health, I know there are some issues there, but overall I'm very positive. And to be very concrete, we studied a lot about what is the impact of digital health on our society. And I think there are three major parts, and these are three major things that will change also in the near future. The first one is about prevention empowerment of individuals. So for the first time in history, together with a smartphone, together with some advice or some smart software, I'm able to answer medical questions that I would not have been able to answer as a non-nurse and non-doctor. So we are really giving this knowledge to everyone, basically through technology, and this can make it the best patient on the planet is a patient that doesn't enter the system. So if we really get the prevention running and the self-helping of people, you're already helping a lot the whole of the healthcare system. So that's one big hopefully changing for the good of our system. The second way is if you look at the cost, and we're here health economists, so let's look at the cost. Most of the costs in our systems come not from you going to the doctor once a month or twice per year. It comes from chronic diseases. So, and if you look how patients with chronic diseases run through our systems, it's not only Switzerland, many countries is fragmented, their journey. So they go to one doctor, they do something, they go to the next, they do the same thing again. So they just hopping from one doctor to the other one. And with the digital health solutions, we could streamline those networks, those flows, these patient journeys. You could take all the data on the way, you could distribute it, you could avoid so much pain and unnecessary treatments. That's going to be a really game changer. And the third thing, that's what media usually focuses on, is really what are the processes that are happening within a hospital, within a doctor talking to a patient and treating her. And so there you comes with your robots and with your AI diagnostics and so forth and so on. The funny thing is, if I talk to Swiss doctors and nurses, they're not so much excited about an AI helping them to be better doctors, to find the right cause of this illnesses faster. They're most ambitious or most eager to have some technology helps them to avoid all this administrative stuff I was talking about. Yeah, so the healthcare of the future is where the doctor can be a doctor and not a secretary. So that's part of the game as well.
Very interesting. Finally, since our main audience are startup founders in digital health and you work closely with hospitals, what would you recommend startup founders to do in order to make that collaboration between a startup and a hospital better and more productive? Yeah,
okay. So unfortunately, there's no magic bullet out there. You have just to find the right person out there. And so you need someone in the hospital that believes in whatever you're doing. And to understand how, for example, these people with power in a hospital, how they think and work, it helps a lot. For example, our doctors in Switzerland, in our hospitals, they have like two budgets. The one is for running the system, the other one is for doing some research. And with doing some research, this like they play money. And once you understand that, when you go there and you should suggest them, how could we use your play money to fund or to make a clinical trial about this? Many doctors here in Switzerland are very eager to publish, so maybe we can join with a university, make a nice publication, increase your authenticity out there, your richness. So you have to understand what is the motivation of the doctors. One of those will be research focused, so with that argument you're spot on. And other doctors, they will be more like, I have to run an organization, so I have 80 doctors and nurses under me, how can I do it more efficiently because my director is pushing me every year to save 5% of costs. And so those doctors won't react at all at this research approach. They will be more like, well, with my software I can help you to save time and you will be here, you will have more patients that you can treat per day because we're increasing the efficiency. So my biggest advice is put yourself in the shoes of your doctors. Many of them won't react to what you think is the most important argument, helping patients. You know, this little baby here, she won't suffer anymore. That's not always how doctors and nurses think. So put your shoes and put yourself in the shoes of the person having the power, have the money, and start thinking about how can I help him or her to solve his problems. And then that's maybe it's a little magic bullet, a little one.
Amazing advice. Thank you, Alfred. I actually want to say that we're colleagues in terms of content producing, in terms of digital health. And Alfred has an amazing podcast in German. So all German-speaking people who are watching us, we're going to leave the link to the podcast under this video. So please feel free to listen to it. So thank you very much for this great interview.
It was a pleasure for me. Thanks you, Alex.
Thank you. Bye-bye.